It wasn't long after Omicron hit Toronto that Adrienne had to close his bar.
We just told everybody that it was for their health and safety, and packed up as much of the produce as possible.
After a staff member tested positive, Ravinsky sent all employees home to isolate. But the process hasn't been clear.
Just because of how difficult it's been to get tests, it's made it really difficult for us to make that decision about when we can actually reopen.
Most provincial guidelines currently advise staying home for 10 to 14 days from the time you test positive. Staff shortages are prompting employers across Canada to close or limit services.
If you were in a workplace setting and someone came in and said, oh, it's just the sniffles, and worked, but then exposed multiple co-workers, the whole business goes down very quickly.
In Toronto and Vancouver, theaters canceled stage shows as performers fell ill. In Ottawa, 53 members of the paramedic service tested positive after a holiday party prompted an outbreak.
I think we're seeing signs of a lot of workplace sick calls and increasing, people being stretched thin in terms of covering needed duties. And so I think it's going to be a bit of a challenge for the next little while.
In the U.S., the widespread sickness caused by Omicron grounded thousands of flights. Now the Centers for Disease Control has changed its guidance.
We want to get people back to the jobs, particularly those with essential jobs, to keep our society running smoothly.
The CDC says people who test positive for COVID but have no symptoms can now isolate for just 5 days instead of 10. Gravinsky says he'd like to see the same changes here.
The ideal scenario would be that the government would be a little bit more nimble on their feet.
Ontario, Quebec, and Alberta are looking at the CDC guidance amid rapidly rising cases in these provinces and may change their own recommendations in the coming days. Nisha Patel, CBC News, Toronto.
All right, let's talk a little bit more about this with Dr. Lisa Barrett. She's in Halifax. Dr. Barrett, as we heard there from Nisha, the CDC has changed its isolation guidelines for asymptomatic people from 10 days down to 5 days. And now some provinces here are considering doing the same. Do you think that's the right move?
Different countries in different areas are considering different ways of reducing isolation at this point. The science around this is a little bit gray, but what is clear is that your peak time of being infective to somebody else is just before and just after you get symptoms. So might it be okay to reduce the amount of time you spend in isolation in terms of being able to infect others? Maybe, but the exact amount of time is not clear. And right now, when we're in a winter surge of cases, we do have to be very careful. If people need to come out of isolation early, it's likely that that should probably be restricted to people who are essential or have to get back to work for various reasons, and not just for the entire population until we get more evidence. So moving target, but it's likely that something's going to change for duration. How long and for whom is not quite clear yet.
Okay, and there are still lots of questions around testing. If you think you've been exposed to COVID, someone who is positive, but you have no symptoms, should you be trying to get your hands on a test, and should you isolate until you do?
Well, if you think you've had what we would call a high-risk contact, and every public health website in the country now has a definition of that, chances are you should be isolating for at least a certain period of time. The answer as to whether or not a rapid test is necessary really depends on whether your province is trying to keep the peak of infections down. If they are, we do need to know about asymptomatic people who may be infected, or else we're going to see a big peak very fast all at once. And so rapid tests for those folks may be very helpful.
All right, Dr. Lisa Barrett in Halifax, thanks so much.
Thank you.